introduction.
Hi, I'm Dr. Cavan, Brunsden. I'm a pediatric dentist. I specialize in taking care of children with special needs, particularly autistic children. My population of patients that are autistic come basically in three different types. There is a category called autism spectrum disorder. This is a spectrum that includes three distinct categories of special needs children. They are the Asperger's syndrome children, they are the autistic children, and they are a category called PDD-NOS, Perceptual Developmental Disorder Not Otherwise Specified. You're most interested in autistic children, so I'll address them as a whole. Autistic children come to our office because they have a special disorder that is a language and communication disorder. Many of them are nonverbal, which means they don't speak properly. They may use English language, but they don't really have meaningfulness associated with the words. So they don't speak well, which means they don't listen well, because words don't have much meaning. They tend to be very visual in their assessment of the environment within which they live. Therefore, we communicate with them in a visual format. For example, if I wanted to tell an autistic child that he was being very good, I would say, very good. This way you're sending visual signals to the child of what it is you wish to say. Autistic children in general don't like close encounters with other individuals. They're very socially dysfunctional. So how do you interact with an autistic child in a close way like I have to, where I have to brush their teeth, I have to clean their teeth, and I have to get inside of their mouth? Well, we go through a sequence of behavioral conditioning techniques called gradual desensitization. In a very firm way, we slowly introduce the child to the dental experience. Sometimes we use puppets, and we'll do to the puppet what we're planning to do to them, and then we'll do it to them and get it over with. So we kind of visually walk them through the process of going to the dentist. This tends to be very, very helpful. In preparing a child to come to the dentist, if a parent were trying to help at home, one of the most common things to use is something called a social story. This is a story of going to the dentist in pictures. And there are actually computer programs where you can download photographs of everything there is in society and create a sequential story of that person's visit, whether it be to the dentist, or to the barber, or to the food store, or to the physician. So, one of the things that we have seen in our office is parents creating their own storybook. This is one that was written by a parent, and she put graphic representations in here of what was going to happen for her child. It was called Going to the Dentist. My name is, and on March 4th, I am going to the dentist with Dr. Brunsden. There's a picture of the dentist and the child lying in the chair. When I get to the dentist, I'm going to sit in the chair. There's a picture of the chair. Dr. Brunsden will then check my teeth with different tools. There's a picture of the mirror and the explorer. Expected behaviors are following Dr. Brunsden's directions and keeping my hands and feet to myself. So this story is guiding the child instructionally through the behavior they're expected to perform. The parent does this at home repetitively over and over and over again, so that when the child actually gets to the dentist, they have learned via this technique of pictorial communication how to manage and help themselves. We find that we can have a great deal of success with autistic children. They have very special, unique personalities. If you learn and understand how the mind of the autistic child works, you can then develop techniques that help them get through difficult experiences like going to the dentist. I wish you all a lot of good luck. Study the subject well. The more you learn, the more you can do good with it. Good luck.